Before you clean that old garage, attic, or storage shed, you need to hear this first. There is a little-known virus connected to rodents that has quietly sent healthy adults into intensive care within days of what first looked like an ordinary flu. And for people over 60, the risk may be far greater than most realize. Imagine this. You spend a quiet afternoon opening a cabin that has been closed all winter. You move a few dusty boxes, sweep the floor, and notice a few signs of mice in the corner. Nothing unusual, nothing alarming, but 2 weeks later, you develop fatigue, fever, and muscle aches that feel like a seasonal illness. Then suddenly, breathing becomes difficult, fast. What makes this virus so dangerous is not just how serious it can become, but how easily people overlook the early warning signs. Many adults never realize exposure happened at all. Today, we are talking about Hantavirus, how it spreads, why older adults are more vulnerable, and the simple mistakes that may dramatically increase risk inside garages, basements, barns, sheds, and even unused vehicles. You will learn the exact symptoms doctors want people to recognize early, the cleaning mistake experts warn never to make, and the protective steps every adult over 60 should start using immediately around rodent-contaminated spaces. And stay with me until the end, because the #1 prevention step is something most people still ignore completely, even after hearing about the dangers. So what exactly is Hantavirus, and why are health experts so concerned about it, especially for older adults? Hantavirus is a rare but extremely serious virus carried primarily by rodents, especially deer mice in North America. The rodents themselves often appear completely healthy, which is part of what makes the virus difficult to notice. They quietly spread viral particles through urine, saliva, and droppings inside enclosed spaces like sheds, garages, attics, cabins, barns, and storage rooms. The danger begins when these contaminated materials dry out and mix with dust in the air. Once disturbed, tiny particles can be inhaled deep into the lungs without a person realizing it. Most people never see the virus itself. They simply breathe it in while cleaning, sweeping, moving boxes, or opening long, unused spaces. What makes Hantavirus especially concerning is the way it affects the body after infection begins. The virus targets the cells lining blood vessels, particularly inside the lungs. As the infection progresses, those blood vessels may start leaking fluid into surrounding lung tissue. In severe cases, breathing can become increasingly difficult within a very short period of time. One of the most dangerous forms is called Hantavirus pulmonary syndrome, often shortened to HPS. According to public health data, severe cases can carry a very high fatality rate, which is why rapid recognition matters so much. Early symptoms often resemble common viral illnesses, including fever, muscle aches, fatigue, headache, nausea, and chills. Because the beginning feels so ordinary, many people do not seek medical attention until breathing problems develop. Researchers also warn that aging changes how the body responds to airborne infections. As people grow older, the lungs become less resilient, immune defenses respond more slowly, and recovery from inflammation becomes harder. This means adults over 60 may have greater difficulty handling severe respiratory stress compared to younger individuals. Another reason Hantavirus receives attention from scientists is the lack of a specific antiviral cure. Treatment mainly focuses on supportive hospital care, oxygen support, fluid management, and close monitoring while the body fights the infection. That is why prevention and early awareness remain critically important. The good news is that exposure risk can often be reduced dramatically with the right cleaning methods, proper ventilation, protective equipment, and awareness of warning signs. Understanding how the virus spreads is the first step toward protecting yourself and your family safely. One of the biggest reasons Hantavirus becomes more dangerous after age 60 is that the body simply does not respond to infection the same way it did decades earlier. Aging changes the immune system, the lungs, and the body's ability to recover from inflammation and respiratory stress. Scientists sometimes refer to this process as immune aging. Over time, the immune system becomes slower and less efficient at recognizing and controlling new infections. The first line of defense inside the airways also weakens. Tiny hair-like structures in the respiratory tract, which normally help trap and remove harmful particles before they reach the lungs, gradually lose efficiency with age. That means when older adults inhale contaminated dust particles, those particles may travel deeper into the lungs more easily than they would in a younger person. The lungs themselves also change over time. Lung tissue becomes less elastic, breathing muscles weaken, and overall respiratory reserve declines. In practical terms, this means older adults often have less backup capacity when illness places stress on breathing. A younger adult may tolerate inflammation or fluid buildup more effectively, while an older adult can become exhausted much faster once oxygen levels begin falling. Recovery also tends to be slower after serious respiratory illness. Inflammation may last longer, energy levels may take weeks or months to return, and hospitalization itself can place additional strain on mobility, balance, and overall independence. Even short periods of bed rest may lead to noticeable weakness in older adults. Another important factor is that many adults over 60 already manage underlying conditions such as high blood pressure, diabetes, heart disease, or reduced kidney function. These conditions may not directly cause hantavirus infection, but they can make recovery more challenging once the body is under severe stress. This is why prevention matters so much. For older adults, avoiding exposure in the first place may be far safer than relying on treatment later. Simple protective steps, proper ventilation, and recognizing symptoms early can make a major difference in reducing risk. One of the most important things to understand about hantavirus is that people usually do not get exposed through dramatic situations. In many cases, exposure happens during completely ordinary activities around places where rodents have been living quietly for weeks or even months. The virus is most commonly linked to rodents such as deer mice. These animals may carry the virus without appearing sick, which means people often never realize there is a risk nearby. As rodents move through enclosed spaces, they leave behind urine, saliva, droppings, and nesting materials. Over time, these materials dry out and mix with dust particles in the environment. This is where the danger begins. When someone enters a closed or poorly ventilated area and starts sweeping, vacuuming, moving boxes, opening containers, or disturbing dusty surfaces, tiny contaminated particles can become airborne. Experts call this aerosolized transmission. The particles are so small they cannot be seen floating in the air, yet they may still be inhaled deep into the lungs. Garages, storage sheds, basements, attics, barns, cabins, crawl spaces, workshops, and old vehicles are some of the most common locations associated with exposure. Spaces that have remained closed for long periods are especially important because rodent activity may go unnoticed for months. Imagine opening a lake cabin after winter. The windows have stayed shut for an entire season. You begin sweeping the floor or lifting old blankets stored in a corner where mice have been nesting. Within seconds, dust rises into the air. Most people think they are simply cleaning. They do not realize they may also be breathing in contaminated particles. The same risk may exist inside garages filled with stored cardboard boxes, old sheds containing gardening equipment, or barns with hidden nesting areas behind shelves and insulation. Even unused cars, campers, and storage trailers can sometimes become rodent habitats without obvious warning signs. Direct contact can also increase risk. Touching contaminated droppings or nesting materials and then touching the mouth, nose, or eyes may allow viral particles to enter the body indirectly. Rodent bites are considered less common but are still possible sources of exposure. Another important detail is that hantavirus particles may remain active in cool, dry environments for a period of time, especially in undisturbed indoor spaces. That is why experts strongly recommend ventilation before cleaning. Opening windows and doors for at least 30 minutes before entering enclosed areas may help reduce the concentration of airborne particles. Understanding how the virus spreads is critical because most exposures are preventable. The biggest danger is often not the rodent itself, but the invisible dust created when contaminated areas are disturbed without proper precautions. What makes hantavirus especially dangerous is that the illness often develops quietly at first. In many cases, people feel completely normal for days or even weeks after exposure and have no idea the virus has already entered the body. The first stage is called the incubation period. This is the time between exposure and the beginning of symptoms. For hantavirus, that period may range from 1 week to well over a month. During this phase, the virus is slowly multiplying inside the body, particularly within the cells lining blood vessels. Most people continue normal daily activities without suspecting anything unusual. Then the early symptoms begin, and this is where hantavirus becomes difficult to recognize. The illness often starts with what feels like a common viral infection. Fever, fatigue, chills, headaches, muscle aches, and body soreness are extremely common. Many people describe deep aching pain in the thighs, hips, lower back, or shoulders. Some also experience nausea, vomiting, stomach discomfort, or dizziness. At this stage, most people assume they have the flu, a seasonal virus, or simple exhaustion. Even healthcare providers may not immediately suspect hantavirus unless there is a clear history of rodent exposure. But inside the body, something far more serious may already be happening. As the virus continues spreading, it begins damaging the delicate lining of blood vessels, especially inside the lungs. Those blood vessels may gradually become leaky, allowing fluid to escape into surrounding lung tissue. The lungs, which normally stay light and filled with air, slowly begin filling with fluid instead. This is the point where the illness may suddenly change direction. Within a short period of time, breathing can become increasingly difficult. A person who felt tired earlier in the week may suddenly struggle to catch their breath while walking across a room or speaking normally. Chest tightness, rapid breathing, and extreme weakness may appear quickly. In severe cases, oxygen levels begin falling because fluid inside the lungs interferes with normal oxygen exchange. The heart must work harder while the body receives less oxygen at the same time. This stage is known as Hantavirus pulmonary syndrome, and it often requires intensive hospital care, oxygen support, and close monitoring. One reason experts emphasize early awareness is because the condition can worsen rapidly once breathing symptoms begin. The transition from flu-like illness to serious respiratory distress may happen within a relatively short window. Recovery, when it occurs, can take considerable time. Some survivors report weeks or months of fatigue, reduced stamina, and lingering breathing difficulties after hospitalization. Older adults may require even longer recovery periods because lung tissue and overall strength recover more slowly with age. This is why recognizing the timeline matters so much. The earlier people connect symptoms with possible rodent exposure, the faster medical evaluation and supportive care can begin. One reason health experts take hantavirus so seriously is because the stories behind real infections are often surprisingly ordinary. Most people who became sick were not doing anything unusual or dangerous. They were simply cleaning, traveling, or spending time in places they had visited many times before. One of the most widely discussed outbreaks happened in Yosemite National Park in California during the summer of 2012. Several visitors stayed inside insulated tent cabins in a popular campground area. At first, nothing seemed unusual. Families enjoyed hiking, sightseeing, and cool mountain weather. But within weeks of returning home, some visitors began developing flu-like symptoms that rapidly became severe breathing problems. Public health investigators later discovered evidence of deer mice nesting inside the cabin insulation. Tiny virus particles from rodent droppings had likely become airborne inside enclosed spaces. Multiple confirmed hantavirus infections were linked to the outbreak, and several people did not survive. The event forced health authorities to contact thousands of travelers who had visited the area during that season. Another documented case involved a retired American man in his early 60s living in Washington state. After winter ended, he spent a weekend cleaning an old storage barn on his property. The building had been closed for months, and he noticed signs of mice, but did not think much about it. He swept dust and droppings from the floor without respiratory protection because he had done similar cleaning many times throughout his life. About 2 weeks later, he developed fever, muscle pain, and exhaustion that felt like a strong seasonal illness. Then his breathing worsened rapidly. He was hospitalized and later transferred to intensive care after fluid began building inside his lungs. Doctors eventually confirmed Hantavirus pulmonary syndrome. Although he survived, recovery took months, and he later reported ongoing fatigue and reduced stamina long after leaving the hospital. Cases have also been reported in South America involving the Andes strain of Hantavirus. In parts of Argentina and Chile, health officials documented clusters of infections moving through households and close contacts. Researchers became especially concerned because this strain showed evidence of limited person-to-person transmission, something rarely seen with other hantaviruses. Health agencies across states like Colorado, New Mexico, Arizona, and Utah continue reporting sporadic cases almost every year, especially during warmer months when rodent populations increase and people reopen cabins, sheds, garages, and vacation properties. What makes these stories so important is not fear. It is awareness. Nearly all of these individuals believed they were doing something routine and harmless right before exposure happened. And in many cases, early symptoms looked almost identical to common viral illnesses, delaying recognition during the most important treatment window. That is why understanding risk factors and prevention matters so much, especially for adults over 60 whose lungs and immune systems may have less reserve during serious respiratory infections. The fifth and perhaps simplest protective step is something many people delay for far too long: checking your home and storage spaces carefully for signs of rodents. Experts sometimes call this a rodent audit, and for adults over 60, it is one of the most practical ways to reduce exposure risk before a problem begins. Start with enclosed areas that stay quiet for long periods of time. Garages, attics, basements, storage sheds, crawl spaces, barns, cabins, and even unused vehicles are common places where mice may hide without being noticed. Rodents prefer dark, undisturbed spaces with access to food, paper, insulation, or small nesting materials. Look carefully for warning signs. Small dark droppings shaped like grains of rice are one of the most common clues. You may also notice shredded paper, fabric, cardboard, or insulation gathered into corners or behind boxes. Gnaw marks on food containers, wood, wires, or plastic can also indicate rodent activity. Another common sign is a strong musty odor in closed spaces, especially if windows have not been opened for months. Some people also notice greasy streaks along walls where rodents repeatedly travel at night. Before entering any suspicious area, open doors and windows first and allow fresh air to circulate for at least 30 minutes. Avoid rushing directly into dusty enclosed spaces, especially after long periods without ventilation. Most importantly, never assume an old garage or storage room is automatically safe simply because it looks clean. Rodent activity is often hidden behind walls, inside insulation, beneath furniture, or under stored boxes for long periods before anyone notices it. A careful inspection today may help prevent a far more serious health problem later, especially for older adults whose lungs and immune defenses may already be more vulnerable to airborne infections. The fourth protective step is using proper protective equipment before entering any area that may contain rodent activity. Many people underestimate how important this is because a garage, shed, or storage room may not appear dangerous at first glance. But when contaminated dust becomes airborne, the lungs can be exposed very quickly. The most important piece of protection is a properly fitted N95 respirator mask. A simple cloth mask or loose surgical mask may not filter tiny airborne particles effectively enough in dusty, enclosed spaces. An N95 respirator creates a tighter seal around the nose and mouth and is specifically designed to reduce inhalation of small particles suspended in the air. Disposable gloves are also important, especially when handling boxes, cleaning surfaces, or touching materials that may contain rodent droppings or nesting debris. Nitrile or rubber gloves help reduce direct skin contact and lower the chance of accidentally touching the face, eyes, or mouth during cleanup. Ventilation matters just as much as protective gear. Before entering a closed garage, attic, shed, basement, or cabin, open doors and windows first, and allow fresh air to circulate for at least 30 minutes whenever possible. This helps dilute airborne particles before cleaning begins. If the space contains heavy dust or clear rodent activity, wearing long sleeves and older washable clothing may also help reduce exposure. After cleaning, clothing should be washed promptly in hot water. One of the biggest mistakes people make is rushing into a dusty space and immediately sweeping or moving items around without protection. That sudden movement can push contaminated particles directly into the breathing zone. For older adults especially, prevention is far easier than recovery. Simple protective steps taken before entering a potentially contaminated area may significantly reduce unnecessary exposure and help protect long-term lung health. The third protective step may be the most important cleaning mistake to avoid: Never clean rodent droppings by dry sweeping or vacuuming. Many people instinctively grab a broom or household vacuum when they see mouse droppings in a garage, attic, shed, or basement. Unfortunately, that simple action can push tiny contaminated particles directly into the air. When dry droppings, nesting material, or dust are disturbed, microscopic particles may become airborne and spread throughout the surrounding space. Once those particles are floating in the air, they can be inhaled deep into the lungs without being seen or noticed. This is why health agencies recommend a completely different cleaning approach. First, ventilate the area by opening windows and doors for at least 30 minutes before cleaning begins. Then wear proper protection, including an N95 respirator and disposable gloves. Instead of sweeping, the contaminated area should be thoroughly dampened using a disinfectant solution. A common recommendation is a diluted bleach mixture prepared according to safety instructions on the product label. The key is allowing the solution enough time to soak into droppings, nesting material, and dusty surfaces before touching anything. Moistening the area helps prevent particles from becoming airborne during cleanup. After the material has been dampened, use disposable paper towels or cloths to carefully remove debris and place it into sealed plastic bags. Surfaces should then be wiped down again with disinfectant. Gloves should be removed carefully afterward, followed by thorough hand washing. Another important mistake to avoid is using leaf blowers or compressed air inside garages, barns, or storage areas with possible rodent activity. These tools may spread contaminated dust across a much larger area within seconds. For older adults especially, careful cleaning technique matters because the lungs become more sensitive with age. A rushed cleanup without protection may create far more exposure than people realize. Simple habits like ventilating the room, avoiding dry sweeping, and using disinfectant correctly can dramatically reduce unnecessary airborne exposure during rodent cleanup. The second protective step is learning how to recognize early symptoms before breathing problems become severe. One reason hantavirus can be so dangerous is that the first signs often look almost identical to a common seasonal illness. Many people assume they simply caught the flu, became exhausted from overwork, or picked up a routine viral infection. The early phase usually begins with fever, chills, fatigue, and muscle pain. Many patients describe deep aches in the thighs, hips, lower back, or shoulders. Some also experience headaches, nausea, loss of appetite, or dizziness. At this stage, there may be no obvious breathing problems yet, which is why the illness is often overlooked during the first few days. But the warning sign that should never be ignored is progressive shortness of breath, especially after recent exposure to rodent activity or dusty enclosed spaces. Breathing may begin to feel heavier over several hours instead of several days. Some people describe chest tightness, difficulty taking deep breaths, or unusual exhaustion after minimal activity. This is the point where medical evaluation becomes extremely important. One challenge for older adults is that the aging body sometimes responds differently to infection. Fever may appear milder than expected, and symptoms can initially seem less dramatic, even while inflammation is increasing inside the lungs. Because of this, many adults over 60 delay seeking care, assuming the illness will improve on its own. Another important detail is timing. Symptoms may not appear immediately after exposure. In some cases, people begin feeling sick 1 to several weeks after cleaning a shed, opening an old garage, moving stored boxes, or spending time in rodent-contaminated areas. If fever, strong muscle aches, and increasing breathing difficulty appear together after possible rodent exposure, it is important to mention that exposure history clearly when speaking with medical professionals. That information may help doctors consider causes that are not immediately obvious during the early stages. The key message is simple. Do not dismiss unusual breathing symptoms after recent rodent exposure, especially in older adults. Early recognition and supportive medical care may make a significant difference in recovery and long-term lung health. The number one step every adult over 60 should take is simple but incredibly important. Talk openly with your doctor and take possible exposure seriously before symptoms become severe. Many people wait too long because they assume fatigue, fever, or breathing discomfort will simply pass on its own. But early communication can make a major difference. If you recently cleaned a garage, opened an old shed, moved dusty storage boxes, spent time in a cabin, or noticed rodent activity around your home, mention it directly during any medical visit involving fever, muscle pain, or breathing problems. Exposure history matters more than many people realize, especially during the early stages when symptoms can resemble common illnesses. You are also your own best advocate. Do not assume every healthcare provider will immediately connect mild flu-like symptoms with possible rodent exposure unless you clearly explain it. Providing that detail early may help guide faster evaluation and more appropriate supportive care if needed. Most importantly, do not underestimate the value of prevention. A simple inspection of your home, proper protective equipment, safe cleaning habits, and early attention to symptoms may dramatically reduce unnecessary risk later. Knowledge is powerful, especially after 60. The goal is not fear. The goal is awareness, preparation, and protecting long-term health before a small exposure becomes a serious problem. If this information was helpful, consider sharing it with a friend or family member who spends time in garages, gardens, sheds, barns, or older storage spaces. Sometimes one simple conversation can help someone recognize a risk they never considered before. The most important message today is this: small, everyday habits can make a powerful difference in protecting your health as you get older. Awareness, preparation, and early action are often far more valuable than people realize. Something as simple as ventilating a dusty room, wearing proper protection, or recognizing symptoms early may help prevent a much larger problem later. And remember, protecting your health does not mean living in fear. It means understanding risks clearly and making smart decisions before situations become serious. If you found this video helpful, subscribe to the channel for more simple, research-based health information designed especially for adults over 60, and I would love to hear from you in the comments. Have you ever discovered rodent activity in a garage, basement, shed, or storage area? Your experience may help someone else become more aware and better prepared. Stay safe, stay informed, and take good care of yourself and the people you love.